Good morning and welcome to Star Media. We're doing another program from the Star Media Studios in downtown Laverne. I'm particularly interested and excited about today's program because we were talking about Medicare open enrollment period and also Social Security. And I have today with our guest is Cary Radisewitz from across the street. Welcome,
Yes.
Cary. Thank you for coming in. Appreciate it.
It's good to be here, Rick. Thanks.
Why don't you tell us a little bit about the business that you and your brother have started, and we'll go from there.
Sure. Yeah, Cary Radisewitz here. I don't know, maybe 3 or 4 years ago, now I think about it, I was turning 65, and so I called my friends up and said, hey, how does this Medicare work? And they're like, we don't know. I'm like, well, who do I talk to? And they're like, we don't know. I'm thinking, like, you guys are smart people. You should know this stuff. No, we don't. How about Social Security? So this went on. Finally, I just said, you know what? I was retired, looking for some way I could help other people. So I said, you know, it looks to me like there's a big need for people with help for Medicare, specifically getting signed up for Medicare and then looking at Medicare options as it continues to evolve, and Social Security. So that's what I do. I help people sign up for Medicare, help people sign up for Social Security, as well as every year this time of the year, you mentioned open enrollment, October 15th to December 7th. We look and people say, hey, Cary, how's my plan? What else is out there? And give them the best options.
Okay, well, thank you. And I am going to ask questions today because I'm in that age group. I've gone through the Social Security sign up. This will be my third year doing the open enrollment for Medicare. And there's more questions than answers, and we got the guy here with the answers today. So we're going to just kind of go through the process of how, like, if I were to be a customer to come in and say, what are our options? You all know, if you're our age, you've probably gotten this book in the mail, and that is thicker than most phone books these days. Of course, you have to be our age to know what a phone book is, but it's Medicare and You 2025, and there are significant changes this year compared to last year.
That's right.
So what are some of the biggest changes that would be the most concerning, and I'll go from there.
Sure. Well, it's important to understand that Medicare is constantly changing. Medicare started in 1965, and originally all there was Medicare. You had Part A, Part B, and that's what you had. And then in the 70s, 80s, there comes along these supplement Medigap plans. So then that became the thing. And then in the 90s, the Medicare Advantage Part C plan came by. And then in 2006, it was the prescription drug plans that came. So it continues to evolve. About 5 years ago, Medicare Advantage plans became a big thing in our southwest Minnesota area. Now, this year, specifically through what's called the Inflation Reduction Act, a federal act, that people who used to spend a lot of money on prescriptions, up to $8,000, that used to be the cap. The most you could spend on prescriptions in 2024 was $8,000. Well, that's a lot of money on a fixed budget. Now in 2025, for next year, it's only going to be a $2,000 max out of pocket. Okay. So that's the good news. The bad news is, in order to pay for that, there was 3 parts of it. Number one, the insurance companies had to say, we'll take on a little more of the hit for that $8,000 to $2,000. Who's going to pay that $6,000? The pharmacy said, well, we'll pick up some of Big Pharma, and then you and I are going to pay for it with possibly higher deductibles, specifically on the more spendy prescriptions.
Okay, so what's the difference is there a difference between a Medicare supplement and a Medicare Advantage Pro?
Yeah. So that's definitely, they're apples and oranges. So used to be, everybody would, hey, back in the day, you had your original Medicare, and then later on, the only option was a supplement. So you took supplement, whatever Medicare didn't pay for, then the supplement paid for. Example, what doesn't Medicare pay for? Well, if you go into the hospital, Medicare Part A doesn't pay $1,600 of your hospital bill. Okay, that's $1,600. But also on the Part B Medicare, that's an 80-20. So Medicare pays 80%, you pay 20. Well, 20% of a doctor bill, 20% of what? I had somebody who had a 20%, their bill at Mayo Clinic was $105,000 for that 20%. So people said, you know what, just soon, I don't feel comfortable with that. Hey, what can I get?
Okay.
And so people took out a Medicare supplement plan, which was wonderful. Basically, whatever Medicare didn't pay for, the supplement paid for. And then later on in 2006, prescriptions became a big deal. And people said, well, I need prescriptions too. So then they had what's called a Part D, as in drugs.
Yep.
And so they had a prescription supplement or a Medigap plan and the drugs. That was kind of the bomb. The challenge with that is that with the cost of that, it really kind of got out of control. Whatever what doctor charged, Medicare just paid, and the supplement just kept paying, and the rates went up double digit, to where we ended up, people were like, I can't afford that. I can't afford to pay my Part B premium. This year it's $174.70. Next year it's $185. Plus, when I add to that the supplement cost of, let's say, $250, $300, and the prescription drug plan of another $50. Now I'm at $350 plus the $185. It's like on a fixed budget, I can't afford that.
So you mentioned the price is $165 this year and $185.
$174.70 this year,
Okay.
and $185 next year for their Part
So,
B.
and that $180 amount, if you're drawing Social Security benefit, that automatically comes out of there, so you're not writing a check for that.
Correct.
right?
Yep.
Okay.
Sometimes people are like, I don't know that I'm paying that. Was it next time you get your Social Security check, you're going to see that on there.
Okay,
Yeah.
very good.
Yeah.
So you got Part A, Part B, Part D, and the supplement is all of that in one.
So the supplement, it covers just the Part A and B, but the Medicare Advantage plan, the other one we haven't talked about, that's called Part C. Now, I don't know, only government could take A, B, and D and make it a C, but that's what they did.
Yeah,
So
okay.
C incorporates all of it, right?
Very good.
And the part about C, why C is the most popular plans today. Medicare Advantage plans are most popular today, significantly more than the supplements, because the cost is a lot less. What happens is Medicare gives let's say next year, the $185 that you're going to be paying, plus whatever Medicare plan on spending on you, to Medicare Advantage plans. It could be United Healthcare, it could be Blue Cross, it could be, it's every one of the plans, every company that has a supplement. Also, most of them have an Advantage plan as well, most of them. And they give it to them, and it's, with that, people pay a lot less, and in fact, a lot of plans are zero. You pay the $185 plus, that's zero. But along the way, you've got co-payments to make. So you might have to, if you go see your doctor, you pay nothing. But if you see a specialist, you might have to pay $40.
Okay.
You go in the hospital, you might have to pay $350. Where on the supplement on the other side, you wouldn't have had to. But there, you're paying a lot every month. So it's kind of like the old auto insurance. If I'm paying every month whether I get in an accident or not, on the Advantage plan, it's like, you know what, I'd rather pay less and only have to pay when I do go to the doctor, keeps costs down.
Okay, so you had mentioned other, United Healthcare, and there's like Humana, Blue Cross, Blue Shield, Sanford has a plan,
Yes.
Avera has a plan.
Yeah.
They're all a little different. And some of them, some plans by all of those companies may be available in Rock County or the zip code, and some of them are not. What's the zip code got to do with anything?
Sure. No, that's a great question. So what happens to have an Advantage plan, you have to have enough resources. One of the things on Advantage plans also have things like dental, vision, hearing, a lot of other extra benefits that supplements don't have. And they also need to have the hospitals and the doctors in the area in their network in order for them to offer an Advantage plan. So you're right on, Rick, what you're saying there. For example, for a while we had United Healthcare came in, but they just came in with Pipestone, Lincoln, and Rock counties to start. And then the next year they added Nobles. The next year to Murray. So if you lived in Murray County that first year, you couldn't get that plan. Now, there was other plans there that they had. So same thing, Sanford plan is only in Pipestone, Rock, and Nobles County. Why? Because that's kind of the, their accessibility to Sioux Falls. And so it's plan specific, and sometimes it boggles the mind. I mean, so you could have a Blue Cross Blue Shield plan in Rock or Pipestone County that's different than the Blue Cross Blue Shield plan in Nobles County. So it really it really tests
So who makes that decision? Is that the government does that, or is it the healthcare, the insurance company that does the zip code thing?
Yeah. So everything is centered to what's called the CMS, the Center for Medicaid and Medicare Services. It's a federal government kind of a holding house, main where everything goes through. They set the standards, say, hey, you've got to step up with this. But it's also the companies dealing with the hospitals. For example, some companies like don't deal. I mean, Mayo's in some networks, Mayo's not in other networks, because Humana right now, they're being Vera and Sanford aren't dealing with Humana because Humana hasn't done a good job paying bills or allowing services or something like that. So Humana is discontinuing in this neck of the woods. It's a lot of moving parts, and and I'm grateful because this is all my brother and I do. We just handle Medicare. We don't do anything with investments or auto insurance or homeowners, because this is enough.
What happens if someone doesn't fit in that window of re-upping for next year? And it's December 7th, I think you said?
Correct.
What if I don't do something until after that? What happens, or how does that work?
Yeah, so basically so you have this open enrollment period, which is designed to, hey, everybody take a look, because at the end of September, you get a note from the current company you're at. It's called annual notice of change, saying here's our new rules are. And then so you have that time to change. And if you don't change by December the 7th, then you won't be on a new plan. You'll be on your current plan.
Okay.
And one of the things that's nice is there's no underwriting. So it's in an Advantage plan. So it's not like, hey, you've got a problem with your heart or something, we're not going to let you. So you always can re-up. In a supplement plan, if you decide to go from Advantage plan, you try to get into a supplement plan for some reason, there could be some underwriting questions there. But so December 7th is kind of a date that says, hey, by this date, you have to pick your plan for next year. Although there's something you don't hear a lot, and that is January and February and March are open enrollment for people in Advantage plans only that want to switch between plans. They can actually switch. And I think a lot of it comes in the fact that people, they think that they want this one, and all of a sudden they get to January and it's not what they were told or something. Because in the past, so much of this has been done by, you get a phone call, right? And the person on the other line, you don't really know if you can trust. You know how it is as far as they're just out trying to get business.
Sure.
And so sometimes January comes and you're like, that's not what the person on the phone told me. That's one of the challenges. We have a lot of reputable people in our neck of the woods that help people with Medicare.
Okay.
That makes it nice. I always say, go do business with somebody you can do face-to-face with. We got a lot of good people in Laverne and around Southwest Minnesota that you can do that, because if you sign up over the phone, your only way to get help is over the phone, and good luck when you're on hold for an hour and they're saying, we value your business.
So, what about someone who signs up on Social Security age and they just take Part A because their employer is providing a credible insurance coverage for them, so they don't need the Part B, and then comes along where to change of jobs or retirement, how do they get on to Part B?
Sure. So that's a great question you have there, and that is, we hear so often, Cary, I don't want to get the late penalty, because late penalties for Part B as in boy or D as in dog actually go the rest of your life. So once you're on a penalty, you're always going to have that. So there's this fear factor, like I got to sign up. And then I say, do you have credible group health insurance plan? Credible meaning that it's as good as Medicare would be. And they said, yeah. I said, then you don't have to sign up. Oh boy, I've heard at the coffee shop I have to. I said, no, you don't. But what happens is when they finally do sign up, so now they're like, you know what? Either they're still working, but they found out Medicare's better health coverage than they have at work. So why not? Why wouldn't I go with, or it's less expensive, maybe is a better way to say it. Or the fact that they are finally retiring. So now we sign them up for a Medicare Advantage plan or a Medicare supplement, and then they get a form. I'm a nerd, so L565 form, L564, and basically it just says that it has a signature from the HR department at work saying this person's worked from this date to this date, had this current insurance. We turn that into CMS, and they're like, there's no late fees.
And they don't have to file that every year.
No, just the one time, and then basically what happens is CMS has the insurance company, let's say if they take Blue Cross. CMS said, hey, Blue Cross, you check it out with this client, make sure that they've had credible coverage, and then they don't have a late payment fee.
I have just two more Medicare type questions. We won't talk much about the donut hole.
Right.
Because that's been eliminated.
Yes.
What's the advantage of that happening, if the donut hole goes away?
Yes.
What is that? What is that?
Well, most people don't know what the donut hole is until they're in it, right? So it's in the past, what happened is when the total cost of your prescriptions between what you're paying on a copay for a prescription and what the company that you're with, let's say it's United Healthcare, reached about $4,400, let's say. From there to about $7,700, you paid 25% of the cost of your prescriptions. Well, if you're taking an Eliquis or you're taking a Xarelto or some expensive prescriptions, you're paying a lot of money. So all of a sudden, you're cruising along and you were paying $47 a month, and now it's $400. And so then you're in the donut hole, and then they call up and said, what's this deal? So now what happens is you don't have that anymore. Now it's maybe a little bit more heavily. So one thing that people are you're gonna see this year, it's really important to know this, is that rather than having the donut hole at the end, now companies are going to hit you with a big deductible start of the year. So
just for drugs then?
Just for drugs.
Okay.
Just for drugs. So let's say, for example, that you're going to have a $495 deductible and your drug costs are like, you might hit that $2,000 out of pocket right up front. First month, $2,000. Well, people are like, I can't afford $2,000. I'm on a fixed budget. Well, that's so they plan that in there, and they call it a softening. What you can do is basically when you're at, let's say you go to Lewis Drug.
Sure.
When you're at Lewis Drug and they say, hey, you're $2,000, and they're like, what? What you do is you say, I'd rather get $167 a month the whole year.
Okay.
So then what happens is, maybe it's Blue Cross they're with. Blue Cross actually pays Lewis the $2,000, and then Blue Cross bills me bills the client,
okay.
$167. So now it's like, I didn't get this, so people can control their costs. And so if you talk with your agent can kind of tell you, here's what you're going to see each month on those costs. So that's a big deal this year. Totally different than the past. You're always worried about the end of the year that having these huge in the donut hole costs. This year, it's more the start of the year that you're going to see that big cost.
Okay. One other thing I think is confusing is you mentioned out of pocket, the maximum out of pocket for the year might be $4,900 or whatever.
Yeah.
Which that's different than a deductible, which I think is confusing for those of us that have been in the private insurance industry, not as a recipient of coverage. We knew if we had a $2,900 or $4,900 deductible, we knew we had to pay that before something.
That's right.
But if I have a $4,900 out of pocket, that's not like I got to pay that first. Not everything falls into that account.
That's
right?
correct. So if you think about if you've had a group plan to work, the Medicare Advantage plans have what's called max out of pockets. And Medicare Advantage plans are basically just the same as you had group health plans. Maybe you work for the city or the county or the state or whatever you work for, and you had a group health plan to work. So they had maybe there was a deductible, and maybe there was a copay along the way, and a group and max out of pocket. That's what this is on an Advantage plan. So $4,900 is pretty common. So that means throughout the course of the year, once all your copays reach $4,900, that's the max you're going to pay.
So could that $2,000 drug fit? Does that fall into that too then?
Yep, it does not. It does not.
It does not.
So basically your exposure for a year on Medicare could be if you had $4,900 max out of pocket, which happens to about 5% of the people ever. The average copay on an Advantage plan is $625. So it's like, my plan might be zero. I might pay the $185. During the course of the year, I'll pay $625, and that's what it is. But if you end up in Mayo Clinic on chemotherapy, whatever, you're going to be like, well, none of that is good. You might end up paying $4,900 out of pocket. Plus, if you took prescriptions during the year that totaled pay $2,000, you could end up that could be not the year you want.
Okay.
Yeah.
Well, as someone who fell into that donut hole this current year, I'd much rather have a donut hole instead of that. You had mentioned a couple of things along our way as some Social Security questions. And if we have a show of hands of how many people had to sign up for Social Security, if you think Medicare is confusing, wait till you sign up for Social Security. On a personal note, Mary and I both fell into that age group about the time COVID was prevalent in all of our lives. And Social Security Administration and the Medicare Association decided that, well, let's just close down our offices and have people in California answering the phone so you can get signed up on Social Security. So, as luck would have it, or misfortune, Mary and I ended up spending a fair amount of time at the Social Security office in Sioux Falls, which is interesting in itself. You get a number from the little kiosk machine, and you go sit in a line of chairs and until your number's called up, and you go behind the door and you sit down in front of a glass window and you talk to an agent. Well, that's about to change. It is going to change for all of us good folks here in Laverne, because this guy right here, he went and he became a registered Social Security analyst. Thank you. Tell us about that and what that means for people that are looking or getting to that age that need to sign up to Social Security.
Yeah, no, thank you. Well, you know what? Right now in the United States, there's 12,000 people turning 65 every day, and Social Security's got to set up their Medicare and all those kind of things. So they love when I just say, hey, let's sit down here and we're going to sign you up, and they don't have to do it. So then so that's Medicare. Then same thing with Social Security, because the fact that when you deal with Medicare, everybody's about Social Security age, so the questions kind of come together. So farther I dug into Medicare and learned more, I thought, you know what, need to learn more about Social Security, make sure you're giving good advice. So came across this degree called the Social Security Analyst, and said, okay, I need to do it. So 40 hours, I worked that week, 40 hours on passing this class. And then I passed the class and I found out that was only module 1 of the 5. So I put a lot of hours in. Anyways, but what we do is we help people, and everything we do is, there's no cost to this thing, but people that want to sign up for Social Security. Social Security, you can actually sign up at 62. So sometimes Social Security question comes in before the Medicare question. So we have people that sign up at 62. We have people that wait until what's called full retirement age, which for a lot of people just turning now is going to be 67. Full retirement age, it means you can make as much money you want to at work and still collect your Social Security. And then eventually, when you turn 70, then that you kind of max out your Social Security. So there is an advantage of waiting about 8% a year. Every year you wait to take the max. But we have a lot of frank discussions, because in reality, probably 65 to 75 is years that we can get out and do things.
Okay.
When we come 80, 85 years old, it's like, I don't know, we're going to be as active, and maybe when you're not as active, you might not need the income, I don't know, additional income or whatever you want to say it. So we have a lot of questions that we talk about things. And then there's things that, should my spouse take it at 62, because he or she's not working and I'm working still. So I'm going to hold off. And then we talk about when you turn 66, even though you're not 67 yet, before 66, the most you can make at work is $22,230. So if I make more than $22,230, my Social Security check, Uncle Sam's going to take $1 I get one. $1, well, I get one. So you lose some of that funding. When you turn 66, between 66 and 67, now you can make $59,000, so you can make a lot more. And then when you turn 67, you can make as much money as you want to, still collect your Social Security check, but depending on how much money you make, you might get taxed on that.
And then that age threshold, that changes periodically from when you were born, right? Some people might have been able to draw full benefit at 65 and a half, then 66 and a half, and I think my case was 67 and a half.
Well,
so that changes along the way?
Yeah, so probably would have been 66 and a half, because what happens, 67 is the max.
Okay.
That is, so I was like 66 years and 10 months. Other people 66 years and 8 months. That went on and on and on, but once anybody coming on now, they're all going to be 67.
Okay.
Yeah.
So people coming on Social Security, instead of going to Sioux Falls, making an appointment, trying to do it online, they can contact you, come to your office, climb the mountain of steps, and then you'll sit down. Now, I remember we had to provide, a marriage license or a birth certificate and driver's license. Is that all stuff that they need to bring with you as well?
Yep. So what happens is, because the Social Security is, let's say if something happened to me, my wife would get the higher of our two Social Security incomes, right? And so they need to know, were you married 10 years? If you're married 10 years, then even though you're divorced, you still could get your ex-spouses half their Social Security if they pass. So there's a lot of things that come into play. So yeah, and so sometimes it's, hey, what's your ex-spouse's Social Security number? You don't need to have it, but it helps to have it. So we go through a lot of that. So what I encourage people to do is they go on to ssa.gov, socialsecurityadministration.gov, and they create a sign-in. So once they come to my office, we sign them up, we get in there, and then I kind of coach them through, here's that, and then we say, well, should we sign up for Social Security? And you might sign up now, but say, hey, I don't want to start collecting until July or whatever, right? So you just tell them, please start my Social Security benefits effective this day. And same thing with Medicare. You always get Medicare Part A if you wanted at 65, but you can say, hey, hold off on my Part B till whenever.
Okay.
So, but yeah, Social Security, it is, and it's to me, it's one of the things I just love about this job, and that is, people, we finish and they turn and said, are you serious? We're done? And I'm like, yep. They said, that didn't take us an hour. I'm like, yeah, well, because I get a lot of reps in at it. So it's nice in the fact that we get through it, and so every time there's something different. All of a sudden you're going and you're saying, hey, have you had any disabilities? Yes. Okay. That opens up. Now they got SSDI. So that's a whole nother story. Or do you have any children at home that are disabled? Okay. Then there's benefits to those that are, that kind of getting in the weeds here a little bit, but there's, no two people are alike in situations.
So is there continuing education for this program then?
Yeah. And then not only that, but also sometimes it'd be like, so I've got somebody Laverne, who's selling their business, who wants to start collecting Social Security, and they're like, how much money can I make? Because I know you said I couldn't make $22,230. Me selling my business, taking that payment, does that count towards that? No, it's W-2 and it's 1099 payments, so that doesn't count. So, but I can go on to this the registered Social Security Analyst site and say, hey, you guys, how does this work? And then somebody will say, boom, and then I'm able to help.
Okay.
Yeah.
Well, I can't. We covered a lot of ground here today, and I'm sure that you're probably a little bit more confused than when we started. But the thing is there's a lot going on, and I would encourage you to call Cary, or as he mentioned, your agent that you deal with in town here. And we have some very reputable ones, and contact them obviously before December 7th and talk about that. If you have any Social Security issues or concerns or problems and want to get ready to sign up, how do they get a hold of you, Cary?
Yep. So basically, you can call my cell 507-227-0466. And then or you email me at CM, my first Cary, M, my little initial, and then Radisewitz, RADISEWITZ at Gmail, or I am right across the street from Rick and the crew here. Rick mentioned that I do have stairs, so when people call me, I'm like, you want to walk stairs? And they're like, nope. I'm like, I'm not the sharpest knife in the drawer. I have stairs. But having said that, I do have a downstairs office.
Okay.
So we do plan ahead. We have a contingency for people who don't want to journey up the stairs.
Very good. Well, this is about coming to an end here pretty quick, and I would like to again thank our sponsors that help bring these programs to us, and of course, that would be Papik Motors, Sunshine Food, the Sunshine Gas as well, our friends out at Real Estate Retrievers, the Laverne Area Community Foundation, and Pepsi-Cola Pipestone, and Functional Nutrition. And it's about time to pull the pin on this conversation, and Cary, thank you very much. Stay tuned for future programming. Thank you.